Hi everybody, I am Dr. Joe Carlo. I'm a certified chiropractic sports physician. I practice in Richboro and I am on the sports medicine team at Council Rock North and South High Schools, working regularly with the athletic trainers to help their athletes. I am also proud to be a part of the treating team here at CK Performance. This is Chris Kurtz, who is the head strength coach here. And Kurtzy does a great job supervising and developing the strength and conditioning programs for the high school, college, and pro players that come through here. Along with Jamie Davidson, working with mechanics and film study and training for the pitchers. Chris McKenzie is a great physical therapist we have here who works on joint strengthening and stability. I want to talk to you today about active release technique. I am full body certified in ART since 1995. I work with a lot of athletes who have issues that involve overuse and what it does to the texture, to the range of motion, to the strength of the soft tissues. Now, the rotator cuff is a big player for baseball players. The rotator cuff involves four grooves: the supraspinatus on top, the subscapularis underneath, and in the back, if you can just face this way, Kurtzy, in the back we have the infraspinatus and teres minor, which are external rotators. So the subscapularis is an internal rotator, and the supraspinatus is an abductor, and the teres minor and infraspinatus are external rotators. Now, in the throwing motion, upon follow-through, the teres minor and infraspinatus are decelerators of the humeral head. So we want to maintain stability in whatever phase that we're throwing. We need proper strength, we need proper instruction, and these are all the things that are provided here at CK, so the athletes are safe, the players are safe and strong in what they do. Now, the teres minor and infraspinatus are decelerators of the humeral head. So as that humeral head is following through, that head wants to come out of the socket, out of the joint, and these two groups along with other tissues are preventing that. Now, in any athletic endeavor, and here baseball is king, tissues that are overused tend over time to thicken and tighten. An overused muscle tightens and it tends to weaken. And over time, with that tension and that friction and pressure that all rise in an area that's overused and tightening, you tend to develop adhesions. It's a cobwebbing, a thickening, a change in the texture of the muscle. So instead of that soft, muscular feel, that supple feel to the muscle, you have something that feels more like ropey or leathery. Now that type of tissue is less flexible, it's weaker, it's more prone to injury. Now you guys are all familiar here at CK with foam rolling, with stretching, all those preventative measures, all those maintenance measures that are really vital, okay, to keep the tissue as loose and resilient as possible. But there are times where that is just not going to be enough, where you're going to find an area in the shoulder or in the back or the neck or the knee where you're just not able to stretch out, roll out, loosen up an area, and it becomes something that weighs on you. It stays on your mind in practice and especially in competition. You just live with it. This is where ART comes in. Active release technique is a way we can break down that thickened, tightened, shortened tissue and more normalize the area. It will become stronger, it will become more resilient, it'll be more able to handle the stresses of your sport. Now, I'm going to have Kurtzy lie in his stomach, face down right here, and I want to show you what active release technique looks like. Now, we call it active release technique because Kurtzy is going to actively shorten and then lengthen those groups while I release the tissue, hence the name active release technique. So I'm going to probe in the infraspinatus and the teres minor, and I'm going to find what feels really thick. And usually when I treat an athlete with ART and I get on that thickened nodular tissue, that leathery, ropey tissue that's developed from overuse, that athlete will say, yeah, that's really tender there. And that will be an area that's probably a source of restriction that he's been dealing with for some time. So I'm going to have Curtsy start in this position here. He is then going to follow through with a straight arm and finish thumb down. Now in this position, I'm fully elongating the infraspinatus and teres minor. So he'll start here. I'm going to bear down that infraspinatus, and he will lengthen that muscle fully and stay there. And during this period right now, I'm releasing that thickened tissue. Come back again. I'll move through another region of the infraspinatus. He will elongate it, and I will resist that tissue moving under my thumb and consequently break it down. Then I'll move into the teres minor, a little lower and lateral. Lock onto that tissue. He will do the same movement and fully elongate that group. And we'll do it again. Same movement, fully elongate. Good. All right, now you come on back up, Chrissy. Typically, when active release technique is performed, what you're doing is you're providing immediate relief from that restriction to the player. So as soon as I'm done, we do range of motion testing and studying. We utilize Dr. McKenzie, the physical therapist here, to remeasure, check strength and measure range of motion measurement, and the athlete will say, wow, I feel looser, I feel better, my hitting went better, my throwing went better. It's immediate. It's a quick kill for that thick and tight tissue that develops. And it's part of the team approach. You have to have the physical therapy for range of motion strength assessment, stability work for a joint that's been involved in injury. You have to have the proper training techniques for strength and conditioning, full body that you have with Curtsy. You have to have the video analysis for throwing that you have with Jimmy Davidson. And see, in the case of this situation, I'm working as a team player because we have a situation where we have thickening and tightening, not only in the infraspinatus, but the posterior capsule, the back capsule of this shoulder. It's going to affect the mechanics of this player's throwing arm, which in turn is going to result in elbow injuries. If not corrected, it's going to slow down his strength conditioning with Curtsy. It's going to affect his overall mechanics and his work with Jimmy Davidson. And ultimately, he's going to have problems. He's going to constantly be in here with physical therapy. It's going to stall the whole parade. And we don't want that. So we want to break down that thick, tight tissue and help him to have more normalized strength, range of motion, and function, and get him on his merry way. That's active release technique. I will be here to work with you players on Saturdays from 1 o'clock to 3 o'clock to show you what ART is, to show you how it works, and to work on whatever areas that you and Curtsy and Dr. McKenzie, Jimmy, are seeing our problem for you so we can resolve those scenarios and get you back to square one so you can play just the way you want. Thank you so much.